Hello everyone. Have you ever wondered what paints the masterpiece of health within you? Today, we'll delve into the complete blood count, a window into the hidden stories your blood tells. The complete blood count is a vast landscape, but fear not. Today, we begin our exploration with the fundamentals. What is CBC? And why is it crucial in medical diagnosis? Get ready to demystify your blood work and gain valuable health insights. This is a representation of a CBC report, which provides essential information about the patient. In the upper section, you'll find general details such as the patient's name, gender, referring physician, identification number, and the date of specimen collection. Below, the CBC parameters are listed, each carrying significant importance. In my upcoming videos, I will delve into each parameter comprehensively, discussing its interpretation and impact. By analyzing the readings of these parameters, we can make preliminary diagnoses. It's crucial to note that specific factors can lead to variations in these parameters, resulting in either an increase or decrease. While there are standard normal values for each variable, it's worth mentioning that these values may vary slightly between different laboratories. Before we understand the importance of CBC, we need to know: what is CBC? What are the various parameters of CBC? What are the variations in CBC parameters? What these variations can tell us? How these variations affect the assessment and care of patients. Imagine a tiny window into your entire health. That's the magic of the complete blood count CBC, a simple yet powerful blood test that paints a vibrant picture of your well-being. Think of your blood as a bustling city, teeming with tiny residents, red blood cells carrying oxygen, white blood cells fighting infections, and platelets ensuring proper clotting. The CBC meticulously counts these citizens, revealing their health and numbers. This information unlocks valuable clues about your overall health, potential diseases, and even your body's response to treatment. Just like deciphering the stories of a city's residents, the CBC can diagnose and monitor a wide range of conditions. Whether it's anemia's whisper of low red blood cells, the shouts of infection through elevated white blood cells, or the quiet whispers of leukemia, the CBC listens carefully. If the numbers seem off, the CBC acts as an alarm, prompting further investigation and ensuring your health stays on track. Ready to unveil the secrets your blood holds? Get a CBC. It's a safe, quick, and informative journey into the heart of your health. Beyond its technical name, the CBC goes by many aliases: hemogram, full blood count, or full blood examination, all highlighting its comprehensive nature. The complete blood count CBC can serve as an informative tool for a variety of scenarios, such as to diagnose anemia, etiological and morphological types, hemoglobinopathies such as thalassemia, sickle cell anemia, and hemolytic anemia, bone marrow aplasia either single lineage or multilineage, nutritional deficiencies like iron, vitamin B12, folic acid, parasitemias, malaria, filaria, leishmania, thrombocytopenia, primary due to non-production or secondary due to peripheral destruction and bleeding disorders, various viral fevers, and autoimmune conditions. To diagnose infections, leukocytosis, leukopenias, eosinophilia, monocytosis, lymphocytosis, various hematopoietic malignancies like leukemias, various dysplasias like myelodysplastic syndrome, spillage of lymphoproliferative solid tumors, metastatic malignancies. To diagnose effects of various drugs including chemotherapy and radiation therapy and effects of various toxins and chemicals. To diagnose effect of various types of stresses like traumatic, metabolic, neoplastic and surgical stresses. Your blood whispers its secrets in many voices. The complete blood count listens carefully, analyzing each parameter like a detective examining clues. From red blood cells carrying oxygen to white blood cells battling infection, every component tells a story. In this video, I will provide an overview of each parameter of the complete blood count CBC. In future videos, I will delve into each parameter in greater detail, exploring their significance and implications for overall health and disease status. Stay tuned for these upcoming videos, where we will explore the CBC in depth and gain a deeper understanding of this essential diagnostic tool. Here is the list of RBC parameters. RBC count having normal values of 4.2-5.0 into 10 raised to power 6 per millimeter cube for women and 4.6-6 into 10 raised to power 6 per millimeter cube for men. Hemoglobin normally present 12.0-15.8 grams per deciliter for women and 13.3-16.2 grams per deciliter for men. Hematocrit normally is 35.4-44.4% for women and 38.8-46.4% for men. Mean corpuscular volume is about 79 to 98 femtoliters. Mean corpuscular hemoglobin 26.7-31.9 picograms per cell. Mean corpuscular hemoglobin concentration is 32-36%. Red cell distribution with coefficient of variation is 11.5 to 14.5%. While red cell distribution with standard deviation is 35 to 45 femtoliters. And normal reticulocyte count is 0.8-2.3%. WBC parameters. Total WBCs are 4,500/1000 per millimeter cube. Neutrophils are normally 50 to 70%. Lymphocytes range from 25 to 35%. Monocytes are 4 to 6%. Eosinophils 1 to 3%. Basophils 0.4 to 1%. Bands 0 to 5%. Now the platelet parameters. Platelets normally are 150,000 to 450,000 per millimeter cube. Mean platelet volume 7.4 to 10.4 femtoliters. Platelet distribution width 9 to 13 femtoliters. Platelet crit 0.108 to 0.282. So that's the end of our introduction and why CBC is so important investigation and diagnostic tool. In our next part 1 we'll teach you read, look, judge and diagnose each and every parameter professionally and master the technique to read CBC report. If you found this video helpful, consider joining the health curious community by subscribing. Stay tuned for more insightful medical explorations, empowering you with medical knowledge, step by step, for a brighter, healthier tomorrow.